So typically psychedelic medicine involves a chemical substance, the chemical derivative that may have been created synthetically or taken out of a plant-based, the white powder essentially, whereas entheogenic healing uses the plant-based substance, for example, peyote, psilocybin, or the ayahuasca vine, and the psychotria leaf that's an admixture. Psychedelic medicine is typically done in an individual context with a 2-on-1 therapist. That's the emerging research model, at least 2 therapists per individual patient. There's been some talk, I heard earlier today, Devin and others talking about group therapy possibilities, but they're definitely, psychedelic medicine seems to be landing on a small individual type practice, in contrast to the entheogenic healing shamanic type practices that again are characterized by ayahuasca ceremonies or peyote ceremonies. And often done, I guess another aspect is psychedelic medicine typically done during the daytime, whereas often shamanic types of practices are done at night. The psychedelic medicine, of course, is required to be prescribed by a physician working within the Western biomedical model that requires a physician's prescription. Even though there may be other therapists involved in conducting the actual work, it still does require a physician's prescription. Whereas obviously in the entheogenic healing territory, it's conducted by a curandero or shaman without any of that kind of trappings of the biomedical model, for better or for worse. The clinical protocols are obviously textually based and very exhaustive in terms of setting out the kinds of practices that are required for doing clinical research, whereas the protocols for entheogenic healing are much more informal, following an oral tradition and involving other types of sort of spiritual elements, perhaps from different cultural roots that they're derived from.